My name is Marc Sieglebaum. I'm the director of the Urologic Oncology Center at the Cancer Institute at St. Joe's and also the chief of urology at St. Joe's. I do all aspects of urologic oncology except for pediatric oncology, which is generally done in a university type setting. And we have a broad range of services that we offer to our patients here. The Urologic Oncology Center is a center that wraps all the various disciplines about cancer care into one institute. So many hospitals have urologic oncology surgery perhaps available to them, but not many institutions have the surgical aspects, the medical oncology aspects, the radiation oncology aspects, all wrapped under one roof. And they also don't have the ability to look at each and every individual patient with every single discipline, examining and reviewing all details of the patient in one room. And I think it's incredibly helpful because surgeons might have one opinion, radiation oncologists or medical oncologists might have another opinion, and instead of delaying treatment weeks or sometimes months, we can have a decision made within days even in very complex patients. For straightforward urological cancer patients, it's really not necessary to be in that situation, but for complex patients, it's incredibly beneficial to them to have all the disciplines in one room and to come to some sort of consensus opinion about the best way of approaching that particular patient's cancer. We have one of the busiest, if not the busiest, robotic radical prostatectomy centers in the state. We were the first community hospital to perform robotic prostatectomy and have done close to 1,000 of those here now. We're very proud of those efforts, and in fact we have the latest, most upgraded Da Vinci SI robotic equipment that's offered by the Intuitive Surgical people. So we feel we have not only the best surgeons and the best operating team, but the best piece of equipment as well to perform the surgery, both for prostates, kidneys, and bladders. My patient care philosophy is I'm an eternal optimist, so I always approach things from the aspect that I can cure them. Even when their cure may be a little difficult, it's not as if I give them an unrealistic approach, but I will always give them a hopeful approach and let them know the options that are available to them and what's realistic and what isn't realistic. But I'm always approaching it from the hopeful side, that's first of all. Fortunately, most of my patients are curable, and fortunately we can offer them complete cures, and that is an incredibly empowering thing, both for myself and for the patients, to walk out of here knowing that, well, gee, an hour ago I had cancer, but now I have cancer that I think I can beat.